Hello, I'm Dr. Mark Hancock. In this video, we're going to be talking about subcutaneous mistletoe. And that means mistletoe that we're going to use a needle to put under the skin. And this is actually the most common way mistletoe is used. Before we start out, I do need to state our common disclaimer that this is not a medical advice video. Please seek medical advice from your own healthcare provider. Mistletoe and many of the other treatments that we discuss at Humanizing Medicine are not yet FDA approved, and we cannot endorse them to cure or treat any disease. We might talk about individual results, and I have seen individual results, and I hope you have results, but we can't extrapolate those to have a general expectation of any sort. Subcutaneous mistletoe use. Basically, we inject initially in a series format. And that's very common with the several varieties of mistletoe. We're talking about European mistletoe here. So that basically is a species Viscum album. American mistletoe does exist, and you probably see it all around you if you're looking for it. I pass under several trees of it that have it on my way to work. And it grows as big green balls in the tree, and it looks actually really similar to European mistletoe. But there are 4 companies in Europe that extract the mistletoe, and they do it all in a sterile fashion. They put it into ampules. I'll show you an ampule. This is actually Abnoba mistletoe that you can see. Hopefully this can focus a little bit. And when we talk about an ampule, this is what that is. It's sealed glass all around and sterile inside. Abnoba has a little dot here, and that means it faces up. We have a different video that tells you how to open these and extract the mistletoe properly. So inside of that is completely sterile. All the companies in Europe have to pass strict regulations for stability and good manufacturing process, and they have each their own unique way of manufacturing. The extract process is different depending on the product. The company Helixor actually has different constituents in it because of the extraction process than Iscador, which is a different company, or Abnoba, which is another manufacturer that tends to have very potent mistletoe. So that's good to keep in mind. Mistletoe plant is a semi-parasite, and it's growing on host trees. These host trees are quite important too. We'll get into that in another video because it's very complex and specific, gives a bit of a flavor or a purpose for specific host tree mistletoe for certain constitutional types or for certain tumors. Generally, subcutaneous mistletoe is done on a rhythmic basis, and most solid tumors, we're going to use it 3 times a week. This does vary in leukemia, lymphoma, multiple myeloma. We do it on a different schedule. But basically for main use, I select Monday, Wednesday, Friday to standardize it. And I'd say that the more you can make anything a part of your healing routine, the better it is for you that you anchor yourself in it, in your own activity. Most of the things that are done in cancer care are done to you or someone you love, and it makes you feel powerless. The things in integrative oncology, you get to do yourself. You get to exert your will in a healing way. And that, I think, alone, no matter what you're doing, it has a beneficial, a good impact. So it's great if you can set aside a calm time during the day to do the injections. People do ask, is there a best time? And looking at body temperature rhythm, I would tend to say the mid to late afternoon is the time that you get a core body temperature elevation. So that is the best time to aim for injecting mistletoe subQ. The lowest point's in the early morning before we wake up usually. So basically late afternoon, if you can, doesn't have to be that, but if you can, that tends to be good. The key part is that you're engaged and that you know that what you're doing with mistletoe is good for you. So what is mistletoe doing in your body? What are the benefits? Well, there's a lot of compounds in mistletoe extract. The most important, most studied one by far is mistletoe lectin. You may have heard that lectins can do a lot of different things in the body, some of which are not that good. That's true, because there's a lot of different kinds of lectins. And the word lectin comes from the root that is common to select or selective. So lectins are very selective. Mistletoe lectins happen to be very selective to shutting down the ribosomal subunit of cancer cells, and that triggers apoptosis. So that's a good thing. And the fact that it does that has been well established in preclinical trials. The other vastly selective important thing lectins of mistletoe do, and this is where it really gets interesting, they stimulate dendritic cells, and those go on to stimulate and have propagate your natural killer cells and your T cells. The best place I've seen this is a study that happened about 20 plus years ago. Researchers said, well, we know mistletoe gives a red skin reaction, it's warm, and when you put it subcutaneously, well, let's see what happens in the actual skin. Let's take a skin punch biopsy from the reacted area from volunteers and look at it. So they compared controls that didn't have mistletoe to ones that did. Pathologists didn't know who had what. They just described what they saw. And the pathologist said, wow, there's masses of T cells, natural killer cells, macrophages, activated dendritic cells, not just the quote immune system, but because there are a lot of immune cells, and this upregulation was something we call the Th1 immune system. That's the tumor eliminating immune system, also the antiviral pathway. So this is literally cells that travel around the body and they check badges, and there is a molecular pattern on every cell that's displayed on the cell membrane. And if that looks weird, then the cell gets killed. And the cells that do that are the T cells and the natural killer cells. Basically, they're saying this cell is not part of your organization anymore, and it needs to get out. That's one very important property of mistletoe. It engages your own immune system so that it can then do proper work that it is really supposed to do from the very beginning, before you even had cancer. So that can be quite transformative. Our immune system really has healing potential. That's the gist of what lectins are doing. Viscotoxins, second big compound, they're the other component in mistletoe that's heavily researched. And those have a toxic effect just to cancer cells. They bind to the cell membrane, the negatively charged on cancer cell membrane pulls it to it. And they, in fact, make a hole in the cancer cell membrane, which then kills it. So it has a dissolving effect. The viscotoxin probably takes a lot more of the compound to work. And I think if you look at series dosing, you tend to use a very small amount. And in the first few weeks of using mistletoe, a lot higher after several weeks or months go by. Our clinic usually starts people with Helixor brand. In the first week of that series, you're only getting 1 milligram. Many people don't have any reaction to that, and occasionally have a small reaction. A very rare person might have a really big, more than 2-inch bed reaction to 1 milligram. Each of the series of Helixor is 7, and you can always tell who knows mistletoe what provider does, because Helixor, as a result of having inpatient medicine over in Europe where it started, and they have integrative inpatient hospitals, they created a fast start. So they wanted some patients to be able to get to series 4 very quickly because they had aggressive tumors or they were robust enough to do it. So they started a fast start series. They named that series 3. I wish they had just called it a fast start series. And so with the series with Helixor, it goes 1, 2, and then 4. You skip series 3. I know it's confusing. Potentially, with a lot of discussion, we might choose a more aggressive start using series 3 and then going straight to 4. But most people are going to go 1, 2, and then 4. We get the question a lot, what happened to series 3? We did not leave it out by accident, and you're doing fine. We tend to have a goal reaction. Many people will repeat series 1, sometimes twice, before going to series 2. We'll talk about that in a bit. We tend to have a goal reaction, and that's going to be 1 to 2 inches. And it's An unusual thing about mistletoe, really, if I told you to take this blood pressure pill or any other medication and you'll know it's working when you feel dizzy and et cetera, you'd say that's really crazy medicine. And it would be. You don't really want to have a side effect from a pharmaceutical. Mistletoe, we also don't want side effects, but this head reaction is actually a desired effect. And maybe it's in between. I would call it a desired effect. So we don't want anything super painful, anything too big, and we typically don't get those things if we follow directions properly and are somewhat careful with it. We do want to see some reaction because that signifies the immune boot camp presence that you have created, and it really enforcing, supporting your own autonomy in the body. And that's really key in the skin reaction. Ideally, it's again 1 inch to 2 inches in diameter. And it's going to be red, a little bit itchy. It can be indurated, that means a little swollen, like a mosquito bite or maybe a bee sting. And if you have a skin reaction, that reaction typically at first won't happen right away. It'll usually max at around a day or sometimes two after you first start out. It's important to check in by text with us. We want to know that what you're doing is right and that you're on the right track. And usually you want to know that too. Eventually you'll become your own expert, but in the first few weeks, it's not uncommon to get a few texts here and there and get some pointers. Everyone's immune system is different, so your reaction is going to be different, and we may need to make some fine tunings. If you have a skin reaction that's very robust, then we will want to decrease your dose. Series 1 of Helixor, you have 3 injections of 1 milligram. That's 2 units, but 1 milligram. And the next 3, 4 through 6 doses, those are 5 milligrams or 10 units. So it's 5 times the dose. We may want to adjust that if you react with a 2-inch reaction to the 1 milligram. We don't want to go straight to 5. We do a fine tuning. But generally, if you have a reaction that's over 2 inches, we'll pause the mistletoe. It's not necessarily a bad thing, but if it's too much, we do want a dose reduction. And you have to be patient with yourself and your body. You're doing the right thing. If you have an area that's still active in the skin, when it's time for your next dose, say you did your Monday injection and you still have a really red reaction on Wednesday, you want to pause and skip Wednesday. And that's fine to do too. Don't just continue to do more new doses. And yeah, you don't have to get hung up that you have to do 3 injections a week. Really, you want that skin reaction to be there in the background, in the terrain of your body, supporting it. Now, if you still have a very active area, then just skip it. And you can have the next injection in a couple more days. That's not uncommon the first few weeks. But it's also very common to have tolerability develop over time. And sometimes, eventually, even those really robust responders at first will have some struggle to get a skin reaction some months down the road. Many people do ask how long will they be on mistletoe? And that does vary. We can make another video specifically about this, but I think ideally at least 2 to 3 years. Some tumors have a risk of recurrence that is even present 10, 15 years after diagnosis. And many people want to be on mistletoe lifelong because of that. But I think after 2 or 3 years, we can really greatly wean the frequency down, often to maybe a box or a series of mistletoe every season. So a lot less burdensome. You're not doing it all the time every week. So after a couple of years, I will usually shift from 3 injections a week down to 2 injections per week, and I will start to take breaks. What are the beneficial effects of mistletoe? I think pretty quickly people often do start feeling better, and I really rely on that. It does tend to often happen. And it has been also found in many big studies and papers on mistletoe that quality of life really improves. The feeling of well-being is present when it used to not be. Often side effects from other treatments are decreased, more autonomy is there. I think if you measure warmth very carefully, you will notice that body temperature goes up on average about a half degree or even a degree Fahrenheit. And that's a good thing. Warm feelings can happen, sometimes in feeling life even. Of course, we want to see physical things, and we can see tumor results. that happen. And I've seen real pushback against the tumor. That's less reliable with subcutaneous mistletoe. And again, mistletoe's tip is an adjunct. In Europe, it's commonly used. 75% of patients with cancer are using mistletoe, but it is mainly used adjunctively, which means it's used in combination with other types of treatments, typically conventional treatments, and it ideally synergizes with those. But ideally, we will see some anti-tumor effects. Some amazing things do happen, and even some prophylactic things. Anecdotally, one patient of mine, she is seen at Duke. She has a very rare sarcoma. It's an aggressive sarcoma. She's one of 13 people at Duke that they're following with this type of cancer. And she's using mistletoe. She had hers surgically removed, and she did not do chemo. They said, don't do chemo yet, wait till it comes back. They expected it to come back because in all the other 12, it did come back. And unfortunately, they actually died of their sarcoma. This patient has not had hers come back. She is the only one in that group, and her oncology team says she's a big outlier. She does tell them that one thing that sets her apart is that she is using mistletoe. They haven't been that interested yet, and that's pretty typical of big facilities, and I understand that in one sense, and the other is partly that there's a bias. But the big thing that she's doing is subcutaneous mistletoe. She's not used IV. So I think that this is one big thing that has helped her. And there's a lot of stories just like hers. And I think we're generating even more. And I hope you'll be part of these stories that we're generating. And I think new studies and better studies are coming out every year. So I'm hoping with time we'll really see that the things that we have in terms of academic research is up to the level of standard oncology. And we need to really get this integrated in the US medical system, because I've seen effects with this, and I hope that you will too. We should talk about side effects. People ask, what are the typical lab results they might see with using mistletoe? And I would say the most common one using mistletoe is that you will see a little bit of bump increase in eosinophils. And eosinophils are anti-cancer cells, not just allergy cells. They're also useful in the anti-cancer, anti-tumor process. We will tolerate 5, maybe up to 7%. If they go higher than that, you need to work with your provider. It's not uncommon to see a little bump with using mistletoe. Lymphocytes sometimes will increase, but not reliably so. If you do a lymphocyte subtype panel, and I'm not inclined really to do that, it's more an academic type test, you will see a shift in what your natural killer cell activity and the activated T cell numbers are. And those go up with mistletoe. But generally, you don't see big changes in the lab results. Other people ask, are there drug-to-drug side effects with mistletoe? And that's often a concern. In fact, Emory University, if I can call them out, the pharmacy team makes a lot of claims about mistletoe that's actually quite incorrect, saying that there are huge potential for side effects. That actually is completely not true, not even backed up with research, in my opinion. So I would strongly, with my experience, disagree with their statements. There's really very minimal drug-to-drug side effects. We're really fortunate. Most drug-to-drug side effects happen between the so-called P450 enzymes in the liver, and those enzymes can be interfered with by both drugs, also supplements, and food. Grapefruit juice is a really common food that interferes with them. And mistletoe has studies that show that it doesn't increase or decrease those functions of those enzymes. So that means that the majority of interactions aren't there. There is a potential concerns with things like immunotherapy, Keytruda, Opdivo, and those sort of things. They really are called programmed cell death inhibitors. And those are working on the same cell types, the natural killer and T cells, essentially cutting the brakes to them. And I think you should be very cautiously with be very cautious with using mistletoe. When I've used it cautiously, I have not seen any trouble with using these PD-1 inhibitors. And actually now there are safety trials as well as trials showing increased survival in the immunotherapy class drugs with mistletoe combined. But I would be judicious and cautious in using it. What about medications that can interact with mistletoe? That's a different question, but it is a good one. And if someone is on a large dose of steroids, especially continuous steroids like dexamethasone, prednisone, you may not get any reaction for quite a while doing the subcutaneous route. It might take 10, 20 milligrams because of the immunosuppressive effect of steroids. So you may need a higher dose of mistletoe, but that's not a bad thing necessarily. I'd rather the immune system be working than suppressed. And in a way, you could argue that you need mistletoe all the more while using steroids so that your immune system isn't completely suppressed and turned off. The important worry is if the steroids are stopped all of a sudden. And if the person doesn't any longer need dexamethasone and you're on a high dose of mistletoe, then your next mistletoe reaction may be really big. So we may want to wean the mistletoe before stopping steroids. So yeah, that's what we're here for. We can help adjust that dose. What about non-steroidal anti-inflammatory drugs or NSAIDs, Motrin, Aleve, that sort of thing, ibuprofen? Those also suppress the reaction to mistletoe, but again, similar thought process to around steroids. If you need them, even if you're suppressing the skin reaction, it's better to do that and have mistletoe on board than not have mistletoe helping. What about other contraindications? If you have a fever already from like an infection, then we need to hold the mistletoe until you're over the infection. Because one, we don't want any clinical confusion. Is the mistletoe causing fever, or are you getting the just a surge in messenger molecules like cytokines and interleukins? What about an acute exacerbation of autoimmunity? Yes, you'd want to not use mistletoe if you have an acute flare of some autoimmune condition. That means like a rheumatoid arthritis flare up. If you just have baseline Hashimoto's, it's actually probably better to use mistletoe because mistletoe does have studies showing that it inhibits autoimmune processes over the long run. And there is a safety trials with autoimmunity. We don't have a large amount of information about pregnancy and using mistletoe. I think you need to consult and have a careful discussion. I have seen some case reports. I have used it in pregnant women before with no effects on the fetus that I could see, but far from conclusive evidence of safety. So I'd be careful here. And essentially, it's a risk-benefit discussion. What about the use of mistletoe in a space-occupying lesion? Basically, we're talking usually about brain tumors. You do want to be cautious because mistletoe creates an upregulation in the immune system. It stimulates immune cells that can then swarm into the tumor and make it swell. That causes edema, causes an increase in size. And in the brain, there's not room for that. That's not that common, but it can happen. So your provider should have some expertise in host tree selection and dosing in brain tumor if they're going to use mistletoe. It doesn't usually happen if you're careful with it. In expert care, I think it is safe. We do have a video walking you through how to do subcutaneous injection, and I would just say that we want to alternate sites as you go. You don't want to just inject mistletoe into the same skin area over and over and over, and that's all. You want a new area as many times as you can choose. Often the abdomen, outer thigh, and the outside of the arm, not the deltoid, which is right up here in the meat of the arm, but the back part of the arm, the outer part of the arm. Those are all reasonable areas to give subcutaneous injection to. The other thing to consider about mistletoe, if you're new to mistletoe and you have upcoming scans, I would want to hold the mistletoe a week, maybe 2 weeks before the scan. Mainly we want to avoid clinical confusion because mistletoe can activate lymph nodes in the drainage area and it'll light up and usually look reactive. So a reactive lymph node doesn't have cancer in it. It's just turned on. And that's really the barracks of the immune system. And that's a good thing, but we don't want it to have undue concern and worry about it. Mistletoe will cause a little bit of itching, a little bit of swelling, redness, and that goes down over time. Usually takes about a day to go down, but at first it might take a week or more for the skin reactions to normalize. Of course, with any injection, there's a tiny risk of infection, but I've seen that to be a problem with careful sterile technique and administration of mistletoe. What is going to happen if you overdose on mistletoe? Uh, Basically, avoid overdose because of the series dose. There's a test dose and it ramps up slowly. But if you did give yourself too much, you would get a fever and you would get a fever response. And it's uncommon, less than 1% of the time do I see that with a regular Helixor protocol. But it is possible and it could happen. Um, is it possible to be allergic to mistletoe? I think true allergies are very rare, and some providers believe it's impossible to be allergic truly to mistletoe. I personally think it's conceivable, but also extraordinarily rare. Usually, what happens is a pseudo allergy where it's more related to the dose and the amount and the sensitivity of the person. And that typically isn't going to happen with the sub-Q mistletoe. It's going to happen with IV about 5% of the time. You get flushing and itching body-wide with pseudo-allergy. Sometimes it leads into more of a anaphylactoid type situation with bronchitis. Again, very rare would that happen. And we do in the clinic use antihistamines like Pepcid, Zyrtec, loratadine. Benadryl will work also. And there's some homeopathics and other natural things that help this histamine response too. I've not really seen a pseudo-allergic response with subcutaneous dosing before, though it's conceivable as a risk. Typically, at very, very high dose of sub-Q, it might be conceivable that a very sensitive person might get a type reaction. But I've not seen it in many, many years of working with mistletoe. Many people ask, is it safe to use mistletoe during chemotherapy? And I say, absolutely. It's even best to use it with chemotherapy. It synergizes with it. Viscotoxins have been studied and shown to give not just 1 + 1 = 2, but 1 + 1 = 4. You know, a synergistic killing effect on the cancer cells. And you also prevent side effects, the serious side effects of chemotherapy a lot of the time. With radiation, you can use mistletoe. You simply don't want to put it into irradiated skin. You need a healthy skin site for a healthy, good skin reaction. Well, I hope that this video has been a big help for you in understanding the ins and outs of subcutaneous mistletoe use, and that the majority of your questions on mistletoe been answered. If you have more, bring them up personally with me. Thank you very much.